Hello friends, my name is Dr. Bimal Chhajer. As you know, we run an organization called Science and Art of Living SAAOL, and charitable organization NGO called Punyya Life Foundation. The aim is to educate everybody on heart disease by our videos, by our camps, by our educational materials. Today I'm going to tell you a very important thing about this cholesterol being high. If the cholesterol is high, then what to do? Remember, cholesterol is the fat which deposits. Remember, there are two people who deposit. One is cholesterol, one is triglyceride, and they combine to form chemical called LDL cholesterol, which gets oxidized and deposits as a blockage. And these blockages lead to heart disease, which is the most common disease of the world and most dreaded killer of the world. Remember, the 30% of the deaths of every person, every country, all the world is due to heart disease. So remember, it's a very important thing. So if the cholesterol is high in your blood, then you have a chance of heart disease development in future, if not today. Now what to do? If the cholesterol, what is the normal level of cholesterol? That is what you have to know first. Remember, cholesterol is explained in milligrams per deciliter. Normal level is 130 to 180 milligram per deciliter. Lot of people previously used to write 2250. Then they wrote 220. Then the medical science says 200. Now the latest dictum is 180. So now 180 to 130 is the normal level. And definitely, I recommend people to go for 130, not 180 or 200. Lot of people, if you have more than 180, remember, the blockages will keep on growing and growing and growing, and sooner or later you will become a heart patient. Obviously, not only cholesterol, there are other reasons which are responsible for the blockages, but cholesterol is number one. Along with that, you have triglyceride, you have high blood pressure, diabetes, stress, and smoking. Lot of other reasons are there, but the cholesterol is number one. So if your cholesterol level you are measuring, and if it is more than 180, please be sure that you have to go for some tests. And these tests are treadmill test. If you can do it, that will be better. And if you want to still find out the heart disease earlier, because with the treadmill test, only after 70% blockage you will come to know about heart disease. So you should either go for another test called CT angiography or angiography, where they admit you, put a wire inside your body. I would prefer you to go for a CT angiography. Now, when you take a cholesterol level, remember your 12 hours fasting should be there in the blood, and that will be the most ideal cholesterol level with 12 hours fasting blood sample. And remember, if the cholesterol is high, there are two sources of cholesterol in the body. One, your liver manufacturing cholesterol, and second is your food bringing cholesterol to the blood. Foods which are having cholesterol are all called animal foods. Remember, no plant food has any cholesterol. Animal food means what? Any kind of meat is animal food. Even chicken or mutton or egg, they are all animal food, full of cholesterol. And remember, milk is also an animal food. So milk will also have a lot of cholesterol. So you should use skimmed milk, and you should cut down all the meats if you want to reduce cholesterol from outside. Now, if the liver is manufacturing extra cholesterol, then you should be looking at, for the genetic markers, and you can search for heart patients in your family. If there are family history of heart disease, then the liver is probably manufacturing double the cholesterol or triple the cholesterol that it should do. So remember, if it is genetic case, you have to take cholesterol lowering drug, otherwise you cannot reduce cholesterol. But anyway, there are two figures you should remember. For prevention, I want below 150, and for reversal of heart disease, I want below 130 milligram cholesterol. If you can do it, you will never have a heart problem. So please remember these figures, but definitely with cholesterol, you should also take care of the other risk factors. So today I'll sign off, and you must subscribe to our channel called Punyya Life Foundation. This is a NGO under SAAOL, and we want to promote heart disease education through this foundation. You can please keep on spreading the words and spread these videos to your friends and family, and increase the subscribers base. Thank you so much. We'll see you again, and keep in touch with me. Thank you. Bye-bye.